Hello, so today I'm going to be talking about healthcare access and neglect at the US-Mexico border. So here's an overview of my presentation. I'm going to start with an introduction on the concept. I'm going to be talking about historical and the current situation at the US-Mexico border. I'm going to then talk about health effects during a migrant's journey, and then after they arrive at the US-Mexico border, access to healthcare in the border region, global health impacts and other considerations, and finally the conclusion. So about me, my name is Patel, and I'm a rising senior at Sand College Preparatory School in Jacksonville, Florida. I'm interested in medicine and public health with a focus on environmental health. I'm passionate about increasing healthcare access. And if you ever have any questions about this presentation, feel free to email me at the email in the presentation right there. So onto the historical perspective. So I want to start with the National Origins Act of 1924, and this was a bill passed in Congress that severely limited legal immigration opportunities, and mainly to countries in the Eastern Hemisphere. It also started charging a hefty tax on Mexicans crossing the border, and this essentially gave rise to what we call illegal immigration today. Another thing I wanted to talk about was the Bracero program, and this took place during the 1940s, during the presidency of FDR. And basically what this was, the United States made agreements with Mexico, allowing Mexican laborers to work in the United States temporarily in the agriculture industry. But this is very temporary, and without a formal replacement after its end, many migrants look to illegal immigration to continue work in the United States and earn a better wage than they would in their original countries. So the current situation, currently we have this thing called a migrant protection protocol. It's essentially the remain in Mexico policy, where you had to stay in Mexico before you were legally allowed to come into the United States. Usually there is an 88.6 days wait from arriving to the United States and having your immigration court date to process your asylum case request. And this gap, it's 90 days, basically around 3 months, leads to many unaddressed health concerns and deteriorations. Metering is another concept to be familiar with. It's basically limiting the number of asylum applications that can be filed per day. So this means people have to wait in long lines in the early mornings just to file an asylum application. And this forces more and more migrants to live in Mexico, and it worsens the healthcare burden. And this policy was strengthened during the Trump administration. Other policy to be familiar with is a family separation policy. And this is where children were left alone to care for themselves. And this led to many mental health issues for children that came to the border. And the last one to talk about was the COVID-19 pandemic, and this is basically exacerbated all these problems, especially with social distancing isn't really possible. And when there's too many people who are traveling to the border, it can lead to crowded and unsanitary conditions as well. So I want to start talking about the physical journey that the migrants do face to get to the United States. So most migrants come from the Northern Triangle, which is basically a bunch of countries below Mexico in Central America. And the trek is easily over 2,000 miles when they start from there and end at the border. And a report from MSF, which is Doctors Without Borders, it stated that more than 2/3 of the migrants suffered violent attacks on their way coming to the United States. And to be exact, more than 20,000 migrants are kidnapped at varying places along the journey. And more than 4,000 migrants have died or are labeled missing in journey from 2014 to 2018. Violence and trauma experienced during this journey has also led to many mental health implications. Specifically, like 9 out of 10 migrants exhibit symptoms of anxiety or depression as a result of such violence they face on their journey to the United States. And lastly, malnutrition and dehydration claim many lives along the journey, especially when crossing deserts and jungles where there's not that many resources. And a record 74% of migrants face food insecurity on their journey. So the arrival to the United States. Many migrants who arrive to the border come with very little belongings and money, and this has led to many neglected health outcomes. The migrant protection protocol that we mentioned earlier that forces migrants to wait in Mexico This is creating a higher demand for basic services in Mexican border towns like Tijuana, Ciudad Juarez, and Matamoros. And it's also led to development of many tent cities. And these create unsanitary conditions, lack of safe drinking water and waste disposal, and a lot of food insecurity. And specifically, over 1/3 of migrants experience homelessness while they're waiting in Mexico for their court trial date. Additionally, underfunded nonprofit organizations are also having to step up to ease the crisis. Casas de Migrantes are being formed, which provide basic services like security, food, water, and shelter to the migrants while they're waiting their time. And urgent health issues are often neglected, which is leading to many deaths in these spaces. The spread of communicable diseases is also another concern with the migration of the border. There have been basic health entry exams, but many of the results are alarming. Just one in Ciudad Juarez, where over 85% of asylum seekers have been reported as having at least some form of basic health problems. Some example diseases that that are outbreaks in this region are measles, cholera, tuberculosis, chickenpox, scabies, and rashes. And it's all a result of the unsanitary conditions of migrant shelters. Currently, there's like many shelters that are operating at 3 times capacity without the sanitation resources. The tent encampments, they lack clean drinking water and often have overflowing toilet and sewage systems. And prior to the installment of showers in many of these shelters, many migrants bathe in the Rio Grande, which is already contaminated with E. coli, and that's also leading to the spread of E. coli. And the United States government is not really funding any preventative measures, like providing vaccinations for the disease mentioned above, or any funding as a result of ease this burden. And as a result, it's creating like a stigma in Mexico as well as in the United States that these infections and outbreaks are occurring all at the migrant shelters, and it's leading to refugee isolation, which that leads to many mental health issues of the refugees themselves. So, so this brings me to access to healthcare in the border region. As you know, there's many diseases, mental health concerns, and violence taking place in these regions, but there's actually a lack of access as well to healthcare and counseling and all that. So like under the MPP, so first of all, under the MPP, the US claims that it's Mexico's responsibility to provide health services to asylum seekers and that the US won't interfere until after the asylum case is approved. And so while Mexico does have services under the INSABI, there isn't much information and documentation about what services are provided and how migrants can seek this. And this is why many migrants aren't using the service at all. It's also estimated that around 25% of asylum seekers have chronic health conditions, such as diabetes and hypertension. And when they travel to the border to file an asylum case, often their medications are confiscated by Border Patrol. And when they try to get them in the border region, they're not readily available, especially in the border cities. Medical exemptions to treat chronic conditions are often denied, and information on the file is also not readily available. So this is why many people are dying on the Mexican side, because they're not allowed to get medical treatment in the United States, even if it's an emergency. One more thing to note is the physician to population ratio. In the border region, that is 0.6 to 1,000. That means there are 0.6 doctors per 1,000 people. And in Mexico, like an average of Mexico is 2.35 per 1,000, meaning there's a lot less medical access and staff in the border region compared to the rest of Mexico, and of course in the United States. So similar trends. The reason why this is important noting is because refugee migration is a burgeoning humanitarian crisis around the world. It happens in many of the regions, and it's not only at the US-Mexico border. Some other examples are the Syrian refugee crisis in the Middle East, the Rohingya refugee crisis in Myanmar, and the Central African refugee crisis, which are a bunch of countries having refugee crises in Central Africa. And the protection of their health remains one of the most important public health issues of the 21st century, as they're moving to newer countries and potentially curing these diseases or health issues along with them. So what are potential, how do we exactly solve this? Well, I've given some potential recommendations to ease the health burden at the US-Mexico border. There have also been talks about ending the MPP in exchange for a better system that assists migrants in getting health conditions checked, rather than neglecting them until they're approved and actually in the United States. Another option is creating appropriate educational informational material, detailing specific processes and the migrants' rights to healthcare services in Mexico and even the United States if and after their application is approved. Additionally, governments need to provide more funding to organizations who oversee the shelters, also known as Casas Inmigrantes. They need to build and expand current shelters, especially when they're operating at 3 times capacity, as I mentioned earlier. They need to provide adequate food, water, and space to migrants to prevent the spread of communicable diseases. And this is especially important in the COVID-19 era, as social distancing is very important, yet these shelters are overcrowded. And therapy and counseling needs to be provided to migrants while they await their hearing, especially to ease many of the mental health concerns faced by migrants during their journey. And lastly, it's important to foster intergovernmental and organizational cooperation in order to offer some standardized and comprehensive response. There's not differing arguments about who should be handling what. And so this makes efficient the healthcare process at the border while the migrants are waiting their period. So in conclusion, for many decades, the health concerns of asylum seekers in the US-Mexico border have been neglected. Fears of violence, mental health concerns, and the spread of communicable diseases are just some of the public health concerns of the US-Mexico border. And access to healthcare on the Mexican side of the US-Mexico border is little to none, and that itself has to change soon. So here's my bibliography of the sources I've used. Thank you so much for listening. And if you have any other additional questions about my presentation, feel free to reach out at my email listed there.